Thank you very much for staying on here on the Joy News. The subscribers of the National Health Insurance Scheme who enjoy healthcare services at mission hospitals, we are told, will be made to pay cash with effect Wednesday, July 2, 2014. It follows the decision by the Christian Health Association of Ghana to withdraw its services to subscribers of the National Health Insurance Scheme because managers of the scheme are indebted to mission hospitals in excess of 50 million Ghana cedis. There are over 183 of these hospitals in the country, and they cater for about 42% of healthcare needs of people in Ghana, especially those in deprived communities. The association had all along been asking the NHIS to pay the arrears, but that has not been done. Well, now, Dr. Justice Yangson is with the Ghana Medical Association. He's joined me via telephone. Hello, Dr. Yangson.
Yeah, hi.
You're welcome to the program.
Thank you very much, my sister.
Exactly what does the GMA know about this?
I guess you mean the bit about the inability of the Health Insurance Authority to pay.
Yeah.
Okay. To be honest with you, this is a very serious issue that I think well-meaning Ghanaians should stand up and tell government and the NHIS to quickly fix the problem. Health care is a very critical part of our lives. Any of us can not take at any time. There's so much difficulty in the system now, and people are relying on the NHIS to survive. The unfortunate thing is that the people who are going to be denied the service have already paid their premiums. What it means is that they've signed a contract with NHIS, not the individual hospitals, but NHIS. So NHIS should ensure that at least they honor their bit of that bargain by paying the facilities involved to ensure that there is some smooth operations for everybody to be happy when he or she, for some reason, has to go to the hospital and access the health insurance. We are taking this opportunity to also add our voice that government and NHIS should quickly fix the problem. This is a serious matter, and it's unfortunate the health institutions involved have been compelled to go the way they have decided to go. It is not their making. They are also being pushed by their creditors. People have supplied them with all kinds of equipment and disposable stuff, you know, the usual consumables we use, medicines, what have you. And these suppliers are on the backs of the management, wanting their money. Some threatening to sue them. Sometimes they turn into, excuse me to say, insults and what have you, because when people are angry, sometimes in the course of having discussions, people go overboard and all kinds of things are said. And it's all because NHIS is not paying what ought to go to them.
Thank you very much, Dr. Yangson, but I'm going to have you hold the line. The Missions Hospital and their bid to reject the National Health Insurance Scheme cards is just one of the many topics that has got to do with the GMA this morning here on News Desk. So I'm going to have you hold the line just for a bit. Government has responded to this move. I'd want us to listen, and then we'll come back to our conversations here.
I want to put out officially that government did meet with leadership of the mission hospitals yesterday, and arrangements have been reached with regards to their delayed payments, and they are going, as we speak right now, they are accepting the national health insurance cards. So the mission hospitals are not turning people away. In the same vein that government has responded to their grievances, and if you remember one of your text messages, they already said there's a lot of fraud and the claims that come from some of, especially the private hospitals. Okay, and that's why the National Health Insurance Authority is trying to bring in capitation and all of that. But in that same vein, I'm definite and certain in my mind that His Excellency is not treating the petition with kids' gloves. He's taking away all the seriousness. Look, to have about 100 Ghanaians come out on the streets yesterday.
It was way more than 100. Let me put that on record.
Well, maybe we counted differently, but
well, maybe you can't count.
Slightly, no problem. I need to go back for an abacus.
I think so.
That's fine. Anyway, but to have about 100 people out there to come out and tell us their grievances, even if it was one person, it means a lot to His Excellency. He's going to be responding. I don't know in what manner. I can't sit here to say he's going to invite them, but I know that the issues they have raised, most of those issues are already being worked on. It's in the process, and I'm sure that I agree with Sarah that we might need to do a lot more sensitization and public engagements, maybe town hall meetings, that kind of thing, to meet people in their localities and let them know that, look, these are the challenges, this is where we are, this is what we are doing, and this is where we are going, and bring everybody along.
But that's not the only matter government has got to do with. On the other hand, we've got organized labor giving government 2-week ultimatum to transfer funds into the various public sector pension schemes, or they would embark on an industrial action. Organized labor said it would resist any imposition of a trust by government on their members in the public services. The labor groups, you can imagine, include Civil and Local Government Staff Association, Health Services Workers Union, Ghana National Association of Teachers, we've got National Association of Graduate Teachers, the Judicial Services Staff Association of Ghana, the Ghana Medical Association, and Government Hospital Pharmacists Association. All of these groups say if by July 14 directives have not been issued for the transfer of funds to various public sectors, sector schemes rather, they will advise themselves. Now that's another matter that's got to do with the GMA, and Dr. Justice Youngson, who is with the Ghana Medical Association, is still here with us on News Desk via telephone. Hello, Dr. Youngson.
Hi.
Obviously, with regards to the mission hospitals and the response we've had from the government person, it just falls in line with what you have said. The government needed to act swiftly. But on the other hand, we have the GMA together with other labor groups giving government an ultimatum to pay into the public sector pension scheme. Tell us more about this.
Well, this is another matter that is beginning to create a lot of problems for public sector workers. You know, we have a new pension arrangement in Ghana, the Tier 1, Tier 2, Tier 3 arrangement. It took effect 2010, that's roughly about 45 years back. The Tier 2 pension funds are what is beginning to create a problem now. The Tier 1 is with NHIS, so that for us, there's no problem. Life is still ongoing at that end. But with the Tier 2, all these public sector groups you mentioned, which basically refers to all the staff within the public services, per the law, together with their management at the various branches of the public sector, have formed pension schemes or trusts to manage the funds of the people involved. These schemes have been duly registered and licensed by the National Pensions Regulatory Authority. Now, since 2010 till date, government has not released the funds into these schemes. Per the rules of the game, government is supposed to release the money 90 days after the formation of these schemes. Now people are just about going on retirement and they don't even have statement of accounts. They don't even know where to go for their money. As unions who are responsible for ensuring that at least our members get what is due them, especially when it comes to pensions, we have made our case to government on so many occasions, and it hasn't yielded any positive results. So we've gotten to a point where it looks like the only language that government understands will have to be spoken. And that is what is now on the table. The other bit is that government wants to impose one particular pension scheme on all public sector workers. And the public sector people are telling government that no, we are going to resist that. We made this clear to government as far back as 2012. There looked like some sort of a break. But now we have every indication that government still wants to go ahead with that arrangement. The danger with that is that people actually fought for this new arrangement to break the monopoly Smith had, to ensure that some competition comes into the system for workers to go home with something meaningful at the end of their service. Now, if government wants to bring one single company to manage the funds of all the public sector employees, what it means is that you are effectively creating another form of SNED. And we are saying that is not it. Then the monies which belong to us. The money is not for government. It's for the workers. It's for our future. It is our own investment that we are talking about. We, the workers, are saying that put the money in these schemes that have been duly licensed, and that is all we want. Government should quickly listen, else very soon we'll have problems to contend with.
I see. Now, I remember when NAGRAT came up with similar issues earlier, government has said, well, the mandatory occupational pension scheme, which is that tier 2, is just a matter for the finance ministry or the employer, which is government, to tackle. And it had really not much to do with you as an employee. That reason didn't go down well with you?
No, I mean, that is entirely wrong. See, it is my future we are talking about. As an employee, the money belongs to me. None of the monies involved at the end of my service will go to government or any government functionary. Right. It is coming to me. It is my fund. Technically speaking, it is my property. So I should have a say in how it is managed. We are saying for 4 years now, the monies have not been released. We want the monies released. It is so simple. The law is clear that, look, the scheme should be formed and money should be sent into the schemes. So the schemes have been formed, the money is not being sent, and how long are we going to continue this way? In fact, people who are near retirement now or who have just started retirement, some of them don't even know where to go get these funds. And this is a big problem that we think we should not allow government to toy with. We are going to ensure that government this time will listen and listen well.
I see. Thank you very much, Dr. Youngson. Dr. Justice Youngson is Assistant General Secretary for the Ghana Medical Association. Now, if you just tuned in, we've been having a conversation around an ultimatum, a 2-week ultimatum given government to transfer funds to various public sector schemes as far as pension is concerned, or face industrial action. And we were talking about 6 of these labor unions. We've seen the Civil and Local Government Staff Association, Health Services Workers Union, Ghana National Association of Teachers, NAGRAT, Judicial Services Staff Association of Ghana, Ghana Medical Association, and the Government Hospital Pharmacists Association. We just finished a conversation with the Assistant General Secretary for the GMA, and he's reiterated the points that indeed government needs to give them the chance to know what is going on with the tier 2 pension schemes. For them, one company coming in to do this wouldn't work for them. It would only create a new SNET-like monopoly. But President Mahama has admitted that the nation has been hit by what he calls several obstacles and challenges, some of which are still being resolved according to him.
I took my oath of office. I officially became the person who had been entrusted with the leadership of this country. And on that day, I made a promise to work in partnership with you, the citizens of this country. I have not forgotten that promise, nor have I forgotten that one of the greatest virtues of leadership is the ability to listen. We have been met with several obstacles and challenges, some of which we have resolved, and others of which we are still working to find the ways and means to overcome. It is not enough for me to say that I share many of the same disappointments and frustrations that have been expressed, though I do. And it is not enough for me to say that I have every faith in government's ability to meet the goals we have set for the country once these difficult periods are behind us, and I do. What I will, however, say is that as citizens of Ghana, I want the same safety and stability for my children's future that all of us want for our children. My comments today will be brief. The time for talking is past. Our people are confident and have never been afraid to make their concerns known. And I want to assure the good citizens of our great nation, the farmers, the fishermen, the traders, the workers, the students, security personnel, and all concerned citizens that I'm listening and will continue to listen.
There's more ahead here on News Desk. We are yet to talk about the update on Ebola, find out what the Ghana National Union of Polytechnic Students have been telling the Ministry of Education as far as the lectures are concerned. You don't want to miss that conversation. I'll be right back. Thank you very much for staying on here on the Joy News Desk. Now, executives of the National Union of Polytechnic Students are headed they are headed for the Ministry of Education to find out from government what it has been doing to bring back their lectures to the lecture halls after they went on strike over the past 2 months. Obeche Amponsa speaks for the group, and he's joined me via telephone. Hello, Obed.
Yeah, coming in.
Have you got there and tell us what's happened?
Yesterday is the 1st of July. There was holiday. The leadership of the Ghana National Union of Polytechnic Students and SRC executives from all 10 polytechnics, we gathered at Cape Coast Polytechnic to see the way forward for polytechnic education as far as the strike action by POTAC is concerned. And when we looked at the situation critical, we realized that it has gotten to a point where it needed drastic action. So we, the leadership, have decided, and we took a motion that we, the leadership, and the SRC executives, we march or we move to the Ministry of Education, and we go there with our books demanding that the minister comes down to lecture us, since they are responsible for education in this nation. And since this issue came up over 1.5 months ago, they haven't done anything, or they haven't done much to bring back our lectures. That is why currently we are at the ministry, and it is raining heavily here, but our students are not bothered. We are right there in front of the Ministry of Education in the rain, waiting for the minister to come and lecture us.
But tell me something. What new are you going to tell the ministry?
No, we ain't going to tell the minister anything new. It's the same issues that we have raised, that if 2 elephants are fighting, the grass does not, in which in this case,
it is the
students. The grass being with the students. So, coming, what we are saying, or what we will continue to hammer, is that the ministry and the government, as a matter of fact, and the agency, should do enough to bring our lecturers back to avert the plight that students of the polytechnics are going through. As it stands now, we don't know whether the polytechnic education is on the verge of collapse. I don't know whether there is a ploy to collapse polytechnic education, but it seems that is what we are experiencing now. Coming, it is so pathetic. It is so boring and abhorrent. Yesterday, when you hear student leaders telling us what their students are saying on campuses, it is so appalling.
And so, who have you met at the Ministry of Education?
Honestly, we just got here and we have got down. We are right there in front of the ministry. This is not a demonstration. This is an inquiry that we want to make as to what the ministry has done so far and what they are doing, and to seek for the presence of the minister so that we'll have an interaction.
I see. Thank you very much, Obed. When you do, I'm sure we'll get an update on it. Obed Cheyan Ponsa is PRO for the Ghana National Union of Polytechnic students. Now, here's what I want to do. I just want to read a bit more of your messages on Facebook. Now, you may have heard that effective Today, July 2, 2014, mission hospitals in the country will reject persons with the National Health Insurance Scheme cards. And well, some of you have been sharing thoughts on that. I just want to read a few of them briefly, then we can move on with the rest of our conversations here. Monty Benjamin from Achime Buakwa says, where is the quality healthcare we were promised? President Mahama. And I'll go on to read Kennedy Asari, who says, from Akomadan, says, Mahama's bad economy is the cause of this problem. I move on to Baba Musa from Tamale, who says, this will be a very disturbing and worrying development should the mission hospitals go ahead with such a decision. I think that the NHIS must be proactive than reactive in order to forestall any negative consequences from this unfortunate development. We plead with the mission hospitals to kindly rescind their decision for now in the interest of the ordinary Ghanaian. Wenty Del Alpha says, this is very sad, thinking a lot of people who depend on us. This government must surely get their act together. Meanwhile, Catherine Mensa says, I'm still in shock that with all the hardship, people are still defending that so-called, well, I'll end it there. Miracle Isaac says, good morning. Not here, Miracle. Well then, I just move on to Hassan Dida. Hassan Dida says, simply say the NHIS will not be acceptable at all mission hospitals from 2nd July because Oh, you don't. We're sorry about that. Maybe you should go back and read it again. Patrick Abbey says, keep commenting so that the end of the day, NDC will win and all of us will say, I did not vote for them. Let your thumb do the talking and boot the NDC out 2016. Meanwhile, Don Ratty says, how could someone living in a Sumra in the Bono-Hafo region afford to attend hospital, especially those of hypertension and diabetic patients? God save this country. Azonto economy. That must be a new term. Now, Mensa Lakim Jacob says, they now want to kill insurance too? I have no idea. Daniel Kombiok Jr. says, it's unfortunate that this has to happen, and so I do wish the president in his wisdom will intervene to salvage the lives of Ghanaians. And Nana Kwame Obinsapon says, what a shock. God bless Mahama. McJourney Stephen says, you called these hospitals mission hospitals. They are, come on, McJourney. We live in an economy where notes speak. I'll leave the comments reading here for now. I'll share a few of them in the course of the program.